It is being touted as the final frontier of breast reconstruction. Sutter Health Dr. Ann Pellet is a breast cancer and plastic surgeon. After her own battle with breast cancer, she created a new option for mastectomy patients. As Crown 4's Noelle Bellow reports tonight, her new sensation-preserving technique is helping women feel more like themselves.
And I was like, what? I can't believe this is real. It really was such a gift.
Serafina Nance is an astrophysics PhD student at UC Berkeley. When she's not studying or floating in zero gravity, she's raising awareness on social media about genetic testing and mastectomies.
I have a PhD background and in science, and I struggled a lot actually to find information that was accessible.
Serafina was just 23 when she found out she carried the BRCA2 gene mutation, leaving her with a very high risk of developing breast cancer.
And so I was scared. I was, angry. I think a lot of sort of conflicting negative emotions. But once I made the decision to be proactive about it, all of those sort of fell to the background.
She eventually decided to have a double mastectomy with reconstruction, but finding out traditional mastectomies leave patients with near complete numbness in their chest was surprising and unfortunately the standard.
Almost everyone you talk to is numb after traditional mastectomy.
Dr. Ann Pellet is both a plastics and breast cancer surgeon at Sutter CPMC's Breast Health Center. After her own battle with breast cancer 4 years ago, she and her nerve surgeon husband created a sensation-preserving technique for mastectomies.
Sensation matters for many different reasons. People can get burned. They can have chronic pain if they have nerve injuries.
Dr. Pellet says new technology has helped them create the trailblazing technique.
We have nerve grafts that we can use. We can use long lengths of nerve grafts. We have better implant technology, better mastectomy technology.
And young women speaking up about the importance of sensation has helped push more surgeons to learn how to do it. On Wednesday, Dr. Pellet took part in one of Sutter's virtual grand rounds, a meeting where surgeons can share their new techniques. Currently, there's less than 10 surgical teams across the country performing it routinely.
We actually have the highest number of patients and the longest outcomes in terms of follow-up of anyone across the country so far, but there certainly are more teams coming.
More than 150 patients have received the sensation-performing mastectomy at Sutter, and 85 to 90% of them say their feeling is back to their baseline. Serafina is one of them, and not only does she feel more confident in her body, she's also reduced her risk of breast cancer from 87% to less than 5%.
Such a gift to find Dr. Pellet, and I think having that sensation allowed the healing process to go far more smoothly because I was able to be in touch with my body.
Serafina says she'll continue to share her story as a way to educate more women about their options.
I just impact one person. That is incredibly powerful. I know I've done my job.
In San Francisco, Noelle Bellow, Crown 4 News.